20 years ago when you launched the center and Kids Health, did you imagine it would wind up having kind of the reach that it's wound up having?
Well, when we started the Nemours Center for Children's Health Media, that was 2 years before the web. So at that time, we could just do video and books and that sort of thing, which gave you local reach, but didn't give you the dramatic worldwide reach that the web does. So I didn't think it would get that big, as big as it is, but I guess I had hoped it would. We prototyped Kids Health in '94, which was only about a year after the web first developed the browser and could get out there. So we were one of the first health websites. We were the first website for parents, kids, and teens. So I had a good sense where it was going to go, but it grew even bigger than I had dreamed. I think what makes Kids Health different and that we really love is that we address emotional concerns as well as medical, technical kinds of concerns. It's not just also about diseases. It's about being healthy. It's about emotional issues. It's about child development. It's about communication. So we have articles for parents on how to talk to your kids about various issues, articles for kids and teens about how to talk to your parents. It really gives an opportunity for kids and parents to think about things in new ways and really take care of themselves.
And is that what you feel remains unique about the site? Because there obviously now is a lot more venues to find information in this category. Do you feel like that ability to target audiences is what kind of remains unique about what you're doing?
Well, when we began the website, it rapidly became the most viewed site about children's health. And even 18 years later, it's still the #1 site, both in English and Spanish, about children's health. And I think part of it has to do with it's very jargon-free. It's easy to use, but it's expert. In other words, every article, no matter how small the topic, is seen by clinical experts, physicians who are health educators and communicators, taking into account both the medical issues and the emotional issues. So many health websites are just about what's the disease, how's it diagnosed, what's the therapy, and ours wraps into how it affects you, what you can do about it, and how to talk to your friends about it, as well as all those other medical issues. So we began, I think, with a unique voice, and we still have that unique voice. A lot of people don't know even the basics of their own body or biology or what causes things from a physical point of view. So it really starts at the basics and then builds up from there. What we say is we provide knowledge, perspective, advice, and comfort. And the comfort part is just as important, because if you're very anxious about it or fearful or you don't want to learn about it because you don't want to know, then that's not good for you. And this makes it feel better to learn. This is our focus, is to create accessible information for families that is really meaningful. And but the fact that it's in a healthcare system, it's at the DuPont Hospital for Children, and we're physicians and other health experts, we know what the real issues are. We know what families want to know, what they find difficult to talk about. And sometimes publishers of health information aren't clinicians, so they kind of imagine what families are interested in. And it's not coming out of experience. I think that's one of the chief differences. And to Nemours' everlasting credit, they thought that this is an important part of the mission, is education. Really, the Nemours Center for Children's Health Media is the only one of its kind in the entire nation.
How do you bridge that gap between the very jargony type of medical talk and what people can really understand?
As a pediatrician, I saw how difficult communication was. So it became a love of mine to work on how you take complicated things and make them simple or simpler. And we have a very talented writing editorial staff here. We have physicians working most or full-time with Kids Health, who, that's what we do. We talk about readability, understandability of things at different levels. For parents, it's one thing. For kids, it's another thing. For teens. And then we get feedback from our readers. So through the years, we've gotten about 200,000 emails. And our users tell us what works and what doesn't. So that helps us. And then we're always paying attention to the usability of it.
Do you worry that a little knowledge can be a dangerous thing, that people start to kind of self-diagnose and start taking the information and not consulting with the people they need to consult with when there is an issue?
Well, that's a very important point. I think partly we're very attentive to not telling people what they should do. We describe things generally. We say in many cases, this is what happens, or here's an alternative, or when to see your doctor. We don't play the role of your personal doctor on the web, and any website that does that is wrong. They shouldn't do that. We've learned from people who see the site that it makes them feel better about going and getting expert opinion. A lot of people are afraid of things, so they don't want to hear, they don't want to know. And when you make it a little safer, then they can go get some help or get advice. We also do a separate website for teachers, Kids Health in the Classroom, that provides educators, school nurses, coaches, and other folks that work with kids, free curricula, health curricula, and lesson plans. We also have a library of videos that we've created that kids here at DuPont and across the country can see at their bedside that explains a lot of things and has personal stories. We provide web content to hospitals. We provide video content. We're creating content for the electronic health record so that people can go into their health record and click on their diagnosis or click on the procedure, and up will pop interactive information. What we're doing is creating content, family-friendly content, in different media, in different platforms, on your iPhone, on your iPad, or Android devices that get you information. So it doesn't matter where you see it or what kind of device you have, it's there for you.